So good afternoon, everyone. It's a pleasure to me to be here. I would like to thank the community, the Indian community here, and also Professor Master for inviting me such a precious event to present a topic. Again, is discrimination against female physicians at hospitals. So I would like to say it's my conflict of interest because I am being financially supported by the Turkish Female Physicians Education Support Foundations, whom I am really grateful to for their thing. So it's today's agenda. I have a question for you. It's an easy one, don't worry. I'll provide some background in the big picture. I have a story to share with you and also some evidence from some medical journals and also news and media, and there's some take-home message. I have to thank more mentors and also discussion with you all. So here is a question. Please keep the answer for yourself. Okay? So there is a man and his son are in a terrible accident. So they're rushed to the hospital in a critical care. So the doctor looks at the boy and says, I can't operate on this boy, he is my son. So who is the doctor? So you have 10 seconds for transfer. 3, 4. Here you go. Think you have all answers you would like to say, share?
It's the mother.
You?
The mother, but I've heard this before. I didn't know that before.
Yes. So the doctor was the mother, but most of the people who I asked this question said, okay, the father. I was like, okay, it might be a homosexual marriage, it can happen, you know, it's normal. But let's think about the majority of the society, at least these days. Okay, so it is a background which I am not agreeing. So here is the precious Hippocrates. We doctors used to take the oath. So this is a piece of part from that oath. So I'm not going to read the whole thing, but I put this part mainly. All other instructions to my own sons and the sons of my teachers. So I hypothesize at my abstract as well that saying. So it might be the reason at the beginning of the history, keeping females practicing the medicine and also the nurses and dentists, you know, let's imagine it's at a healthcare home. And I taught discrimination against female physicians for main parties, male physicians, if you can simply think of, and also female physicians. That's interesting, but it's reality. And also other healthcare professions working in a hospital, including nurses, and also the patients, unfortunately. And I will share some evidence for that as well. So here is the story. So I read this article from the New England Journal of Medicine, very high impact factor journal in the medical field. You might have heard about it. They really publish really high quality of scientific research. They have this article. She's a professor at Harvard, Susan Cohen. So she has this article discussing about struggles of being a female at the field of medicine. So I read it and I said, oh my God, she's older than me. She's staying in the States. I'm from Turkey, developing country still. So but we have so much in common. Although it was 2 years ago almost, I got only 2 years of clinic. And I had the struggles like discrimination against my gender. So I typed an email to her, but I didn't imagine that she could reply me back. I mean, she could reply me back. But here it is, surprise! So I read a response from her Harvard email. So she's saying, come and visit me because, you know, discrimination is everywhere. You're not alone. So it was really supportive for me, and I was surprised because I'm just a poor medical student from Turkey. And I also shared this to one of my professors, Professor Master knows her. She is my professor of ethics. So she said, you should write a letter about this. And I said, I did it and it got published. You can find it, the full text at PubMed. So let's start with the evidence. So I found this, it's from Turkey. So they found that women's health is specifically about OBGYN. So you could think of OBGYN, all the patients are female, right? So you could expect that the most of the also doctors would be female because female would prefer female in a sense maybe. So they found that 28% of the department heads were female. Although I'm not going to read all of it, but 55% of the residents were female. So it shows, although they start half and half almost at the beginning of their careers, but when there is the end of the career, let's say being head of the department, so there is, you see the numbers can spare here. So they said maybe it's because of the unwillingness of female physicians for academic position, which I do not agree, I must say. But I do agree with this part, male dominant structure of the departments. So if you're applying for a position for, let's say you have all the papers and everything else to apply for associate professorship, so your papers and everything will go to your males, most of them, because they are majority. So in a sense, one can say the male professors don't want females so much involved in the field. So there is another really good article which I really do love. It's from JAMA, another really good and highly appreciated medical journal by American Medical Association. So they look at the patients' results at the hospitals treated by female versus male internist specialists. They find that female internists have lower mortality on also readmission rates compared to males. And this is from the internal story, and another one published in British Medical Journal 2 years ago. They said female surgeons had a small but statistically significant decrease in the 30-day mortality and also similar surgical outcomes. Yeah, that's right. So there is another article from a professor from Stanford University. So there is the discrimination starts against female physicians. Because you see, although there are evidence, like as I said, she also said the same articles, lower admission rates, lower mortality, and more cooperative work at the ORs, but she said the medical profession has a moral imperative to achieve gender equality in our highest equation. The sooner the better for every patient's safety and well-being. So what matters at the end of the story is that patient safety and well-being. Here's another speculation from that article, which I do agree as well. So fear of sexual harassment in the field is a hidden curriculum of the girlhood. So if you go to medical field as a female, still you will be suppressed by the male dominant field these days. So you can say, although the National Economics of Sciences also reported that extend longer into the women's medical careers, telling professionals advancement of women. It's unfortunate fact. So another article, they also analyze the leadership roles in oncology. It's just one of the articles that comparing the presental issues and also the leadership roles of the women in oncology. They say it's below 50. But they also said that if the women in leadership, it's almost equal. If the head of the society is women, you will see women and male are almost equally presented. And another evidence from the article is just I picked one of them. It's a random one, but there are many articles you would find. So comparing the grants coming from NHS or I don't know which governmental funding. So they find that there is a meaningful difference, statistically significant, between men and women researchers.
What year was that? What year are these? Could you give us the years of these?
Sure, it's written here, yeah. 2013.
Oh.
Yeah, it's. I mean, there are many of them. I just put like just one of them. There are many articles. It's another point from this article is otolaryngology. You see, there are so many fields in medicine.
Yeah.
Even then, they get a paper published in this paper. It's American Academy of Otolaryngology. That's also shows the importance of the topic as well. And another study is 2008. So they found also the same thing, even in like 10 years ago, a decade ago, there is a ground finding discrimination in terms of males and females. So there are lots of things going in social media these days, so we can't just, okay, I'm reading only the articles on PubMed, not looking to the, what the society is doing at, for social media and news. But we should take the big picture and we look at the articles. We have the evidence and numbers there, but we have also there's some authorities, what they are saying, what they are doing, which I really like as news. National Institute of Health Director, he said he will no longer participate in all male panels. So let's imagine we're having a panel here. I'm the presenter, but I'm presenting one of the males. So it is also discrimination. It's part of it, let's say. So it is another news from Sydney. I mean, I would like to present the whole world, not just only my country, states. It's all around the world. It's one of the key messages, in fact. So this news, it says, kill myself or live. Female surgeons reveal horrifying conditions. And it's happening in Sydney, in Australia, a developed country. So it is one of the things that I would say one of the patients' discrimination against female physicians is because you are being called a female surgeon or lady surgeon or lady doctor. Inside the hospital, we have to wear white coats or we have to wear scrubs. So even though I'm wearing my scrubs or wearing my white coats, the patients are calling me as a nurse. I'm sorry, I respect your profession, but I'm wearing a white coat, which means that I'm a doctor. But they do still call me as a nurse because I'm a female, or they do call male nurses as doctors, right? You would agree, yes. Even though we just met and you were practicing in the States, I just came from Turkey, so that's the whole global issue is that. I also would like to share this quote from the president of Harvard. She said, although she's not a medical doctor, she said, I am not the woman president of Harvard, I am the president of Harvard. That's the thing. So during this New Yorker 2017, so they had this female surgeon, and it got a lot of impact in social media, even though there are like many articles coming in the PubMed. You will see a lot of surgeons all around the world, and this is me, wearing mask, and we got two male friends in that picture. So here is an article saying that embarrassing diversity improves patient outcomes. So we have the evidence showing that we are like equally treating the patients for their best interest. That must be the case because we're doctors. So let's see there are how many tweets. So there are over, I don't know how many, 150,000 tweets, and it had over billions of impressions on social media. So I mentioned about discrimination against female physicians by male physicians. By female physicians, I couldn't find the article at this moment, but because I have a limited time, but I can share some personal stories for this. So what they say is, the female physicians are raised in the male-dominant environment, so they felt that they had to be like harsh and kind of quote-unquote rude just to show they're strong. They shouldn't be feminine. They should look like some males, and that's the thing. Other healthcare professionals, I had shared some stories, and also the patients. So what this graph also saying is, we were discussing the other day with Professor Messer. He said, don't you think it's reflecting the whole society? And I said, yes, it is. We see a whole society here. Thank you for that, Professor. So to take home message would be here from this presentation. So it doesn't matter if the physician is male or female or from LGBTQ. What matters at the end of the day is you're taking care of patients for the best interest of them. If you don't know something, you should ask your superiors. Those superiors could be males or females. And you should go and ask a colleague with the experience of a certain disease, or you think that he or she can take care of that particular patient more than you can do, you should be the case. So I would say we should take care of this poor guy in here. So I would like to thank my teacher. So I really do like this quote from Nobel Peace Prize winner, Malala, whom I also do admire. She is a very strong young woman. And she said, one child, one teacher, one book, one pen can change the world. In this sense, I would like to thank my mentor, Associate Professor Dr. Elif Vatanalı Lutz, for giving me the opportunity to write that article that I published, and also introducing me to Professor Masters, which ended that I'm here presenting this to you. And I also, I would like to be a surgeon as an obstetrician and gynecologist, and I have many amazing surgeon mentors. You will see that most of them are males, but I will put their photos because they are not discriminating at all. I would say neither positive nor negative. They are appreciating my work because I'm presenting there on time and I'm doing my things that are ethical. I do concern patients' safety and privacy and everything else. I'm grateful to those mentors helping me to become a better physician surgeon. And thank you all for the take-home message. We will take care of your patients, and you can email me if you have further comments or questions anytime you want. And thank you for your patience. Please do share your experience, the hospital, or thank you.
So, just as you were explaining this, I was thinking, well, if you don't want to be a strong female doctor looking like a male doctor, right?
Yes.
So what does a strong doctor, or how can you be strong as a woman and still be respected? I mean, how does that look?
Yes. I think it's about experience and knowledge. So if you know something about a disease, let's say, so you ask a question as a patient, I would say with a confidence, I know this, I did it, I read it, I published it. So you have the evidence. So I think the key answer for that question would be the evidence. If you have the evidence, you will have the confidence. So if you have the confidence, you will be the strong one. I guess if you have further comments, please do share. Please.
I find it really interesting. Under the Soviet Union, a physician was a female profession. So most doctors were women. And I'm just wondering, I know so much of the things that were positive under the Soviet Union were kind of brushed aside because capitalism was a wild stallion trampling it. But I wonder about any research on this side of things, because we're now having this very related medical profession from the Western world. But in the Soviet Union, in the whole of the Soviet Union, to be a physician was something that was mostly, it was considered a women's profession. It would be really interesting to research.
Maybe that's the cultural difference in, thank you.
I also,
good to know.
From what I know, like I used to work in ultrasound, and a lot of ultrasound techs came from Russia and immigrated here, but they were all physicians. But they didn't want to go through the whole process to get recertified, etc. And they get paid like crap. So physicians in Russia, because it's a female job, it's a very low-level job, even though you are a physician. I mean,
because I mean, you know, geographically, Turkey and Russia is very close. I was going to give a nurse example. There are so many nurses coming to Turkey, look after for the, let's say, rich and elderly people. And I asked myself, oh my God, there are nurses and they're well-educated. They should be paid more. But now I understand that's the case. What do you say? Please.
I think it's just every day is so overwhelming to learn that in all of the isms we haven't progressed very far along the line of any of the isms, and you know, to see what's going on this close to 2019 is an abomination. I mean, you know, you don't have to portray a strong woman. You have to portray a person that's strong and knowledgeable enough to know when they need to seek the answer somewhere else.
Yes.
And be confident in that competency. I think that when we try to show that we're stronger because of whatever group we're a part of, we're playing the game that the opposition is playing. And I feel pretty strongly that we have to stop that. We have to do the best we can.
Yes, that's
Yeah.
what I said in general.
Yeah.
We shouldn't compare the males and females, but we should acknowledge their experience and knowledge. That
Right.
should be the thing. Yeah, absolutely. Thank you.
Any other comments?
Very excellent.
Thank you.
Thank you.
So, yes, I hope you appreciate we are a majority woman audience. Thank you.
It's good.
Thank you very much, Esra. Great job.
Thank